Hello, I'm Ryan Coffman. I'm the Tobacco Policy and Control Program Manager with the Philadelphia Department of Public Health. Nationally and locally in Philadelphia, vaping is the most common type of tobacco product used by our young people today. I have 5 important recommendations for anyone listening that is a principal, administrator, educator, staff member, or parent about how we can respond together to the youth vaping epidemic in schools, which is a particular setting where youth vaping has become very common, whether it's in school bathrooms, classrooms, or on school grounds. My first recommendation for you today is around policy. It's very important that we revise any tobacco-free policies for staff or for students to include all types of vaping products. In addition, the formation of a staff work group or task force that may be comprised of members of your leadership team could be put in place to develop efforts, implement, and sort of evaluate how the efforts to stop the youth vaping epidemic in our schools is going and make adjustments accordingly. In addition, anyone that works in a healthcare capacity that's asking our young people about tobacco use, that we're also asking about vaping products in that discussion. My second recommendation is around communications and training. It's critically important that administration, staff, parents, anyone working with young people is trained about vaping products. This is a very fast-moving issue, and so being aware of these products, their use, their concerns, and their risks for our young people is of particular importance. Communications can also take a variety of different forms. It could be tailored print, virtual communications, email blasts, robocalls that are regularly informing parents, staff, and students about products like Juul, for instance, which I hold here in my hand, a very particular popular product among our young people today, and that we're warning all users about the risks of all forms of tobacco product use, including vaping products for our young people. My third recommendation is around curricula. So ensuring any tobacco prevention curricula that's used in schools is independent, not connected with the tobacco industry in any way, and includes evidence-based content about vaping products. Fourthly, that you focus on awareness and cessation rather than strictly disciplinary action approaches for youth who are vaping in school settings. Many young people are using these products because they're unaware of what they contain. And sadly, many young people are becoming addicted to nicotine and may need cessation support and resources, not just a disciplinary action approach. And my fifth and final recommendation is around cessation. This is a very new issue, and it's moving very quickly, and there's not a lot of resources at times to go off of in terms of how to treat youth vaping addiction. There are some resources like This Is Quitting, developed by Become an X, which is a text messaging-based youth vaping cessation application that can be used for young people and was developed with the input of current and former youth vapers as well. All the information that I shared with you today can be found in a toolkit that the Philadelphia Department of Public Health has put together, and this can be located on smokefreephilly.org. So I definitely encourage anyone listening to share this resource with their colleagues, as well as to get this information there. Thank you so much for your time.